In a country of 200 million people, more than 113 million live with food insecurity, which means that they live without reliable access to sufficient quantity of affordable and nutritious food. That is almost 60% of Pakistan's population. Pakistan is currently confronted by an alarming malnutrition emergency, with one of the highest child stunting rates in South Asia. 45% of children under 5 years of age in Pakistan suffer from either wasting or stunting. Acute malnutrition or reduced growth rates. To save millions of lives and protect millions more, there is an urgent need for action. Action against hunger. For the last 40 years, Action Against Hunger has led the fight against hunger in 50 countries.
Action Against Hunger was founded in 1979, and Pakistan was one of the first countries that they worked in. So our objective is to first address the consequences of hunger, and that means treating hunger in all of its forms, including malnutrition, mitigating the causes of hunger, and then the third component is to change the way that we view hunger. And that includes both research, it includes advocacy, it includes working with government on policy. And we work with individuals, we work with communities, and we work with government, and we remain committed to those. We remain committed to those objectives and committed to ending hunger.
Chronic poverty, social inequality, and limited access to basic social services, along with persistent conflict and natural disasters, are some of the root causes of malnutrition in Pakistan.
Action Against Hunger believes in continuous improvement, and one of our core value is actually to generate evidences through researches. So that gives us an edge to understand the ground dynamics in a more robust way. Or you can say we can generate evidences that are linked, or you can say aligned with the needs on the ground. We need to address this issue from the core of our heart. Every stakeholder that is engaged in this fight should work with their optimum capacity. We have to focus, we have to address the issue of malnutrition in totality. Otherwise, this will chew up our generations, younger children, and those who are still to come to this world.
Action Against Hunger is committed to enabling improved multi-sectoral programming to address malnutrition in the country. Our strategy is based upon proven models of service delivery, technical assistance, evidence generation, capacity building, and advocacy in times of disasters or periods of stability. The most pervasive and dominant factor underlying maternal and child undernutrition is widespread poverty. Currently, 44% of the Pakistani population lives in multi-dimensional poverty. During the last 5 years, from 2013 to 2017, we were able to help 2.9 million people in Pakistan. We helped almost 1.4 million people in mitigating hunger through our health and nutrition program. We reached more than 1.5 million people to address causes of their hunger through food security, livelihood, WASH, and disaster risk reduction programs. We have always been working at the forefront to change the way hunger is viewed through evidence generation and advocacy initiatives. Malnutrition will continue to slow the country's economic growth and keep perpetuating poverty through a reduction in human capital and productivity, unless steps are taken to ensure that these children do not suffer from stunting during a critical period of their development. Let's work towards a day when no one in Pakistan goes to bed hungry, no child dies of malnutrition, no family suffers from food insecurity. Support Action Against Hunger.